Hello everyone and welcome to this week's edition of Let's Talk Shop. My name is Debbie DiMartini, certified clinical thermographer with Thermal Body Scan in Santa Cruz. And today I just want to touch briefly on a growing trend that I'm seeing. I'm excited about the trend. It's the trend that's talking a lot about stage 0, stage 1, DCIS, ductal carcinoma in situ, which is breast cancer at stage 0 or 1. There's more compelling research that's coming out that's saying that over-treatment and over-diagnosis of these conditions are not changing mortality rates. So what does that mean exactly? I just watched a news report that was from the University of San Francisco. It's on my Facebook page, so that if you'd like to look at that, you may watch it. It's Thermal Body Scan Santa Cruz on Facebook. But it's a study that's come out that they're showing that stage 0 and stage 1 cancers are overdiagnosed and subsequently overtreated, and it is not changing mortality rates at all. What do we do with this information? Well, first of all, the most important thing is to know that you could have benign calcifications, you could have cancerous calcifications, you could have cysts, all these different things in your breast tissue. The biggest thing that we need to be watching is, are they active? Is there activity? Thermography is a different type of test. It is a test of metabolic process and physiological function. In other words, it's looking at and monitoring activity in your breast tissue. That being inflammatory response, developing blood supply specifically with breast cancers. Mammography, ultrasound, MRI, those are tests of anatomy. Those are looking into the body to locate and measure structure or anatomical change. Specifically with breast cancers, things like calcifications and lumps. Now those things can be very, very slow growing. They can be more aggressive and fast growing. The biggest picture that you're going to get with thermography is that tumor active? If it's not, it's that old adage, if it's not broke, don't fix it. What we're calling it is a watch and wait. We're gonna keep an eye on you, do more frequent thermographic imaging, maybe combined with things like ultrasound or mammogram, to see if there's any change going on in that lesion or lump. If there's not, studies are showing that those could sometimes be with you your entire lifetime and never grow or develop into something lethal. So treating those in some cases is unnecessary. So it's exciting news. It's news that I've been sharing with you for 6 years, but nonetheless, I'm glad that the powers that be are finally coming along and releasing this information. Again, be armed with knowledge, better insight for better outcomes. The earlier we catch things, the more activity we see or lack thereof, the better we are for giving you different treatment options and having better outcomes as a result of those. So please check out my website, Thermal Body Scan Santa Cruz, www.thermalsc.com, my Facebook page, and I'll see you again soon for another episode of Let's Talk Shop. Thanks.